Hey there, I'm Dr. Vlad, a general pediatrician specializing in autism for children. Now tell me if this sounds familiar. You start your first session of ABA therapy with your autistic child, and you start thinking in your head, how much longer of these sessions will it be before I can see improvements in my child's autism challenges? It's important to set realistic expectations and understand that progress can vary widely among kids. See, the initial phase of ABA behavioral therapy involves an assessment to develop an individualized plan, which includes observations and interviews and evaluations of your child's skills and behaviors. Once that plan is established, your child will begin the therapy sessions, which can vary in frequency and duration based on the therapist's recommendation. And the therapy itself can take place in home, school, center, etc. The progress in ABA therapy that a child makes will vary drastically amongst kids and is influenced by factors like the severity of their autism, their age, their motivation, and the consistency of the therapy. Now, the range which we can start seeing tangible changes in a child can go from the very first session that they're in ABA all the way to months of therapy before we see improvements. So the initial stages of therapy focus on building foundational skills with gradual progress expected. As the therapy continues, the improvements in communication, social interaction, and behaviors become more and more obvious. ABA therapy is typically a long-term intervention, requiring consistent attendance and ongoing adjustments to the treatment plan to achieve the best outcomes. It can span for years at a time. It's very important to keep in mind that progress with therapy will not be linear, going from having challenges all the way up to having improvements. There will be ups and downs along the way. It may feel like a roller coaster ride at times because other factors outside of therapy will be affecting your child's progress as well, including their own personal growth and maturation, and family and social factors as well, such as their peers. Now, several factors, as I've mentioned, can influence how quickly a child shows improvement in therapy. So first is the age at which they start therapy. The earlier, the better. Early intervention is critical. Children who begin therapy at a younger age show more significant improvements more quickly. Then comes the intensity of therapy. Now, more therapy does not always mean better. New research shows that it can vary from one child to another. However, the initial studies that were done try to aim for a ballpark of anywhere between 20 to 40 hours a week as considered to be intensive therapy to give them the maximum benefits. The number of hours that a child actually attends a session each week can impact their progress. The individual differences from one child to the next will impact how quickly they make progress. So every child is unique and their response to therapy can vary. Now, also, not only the child, but looking at the other end of the equation, the therapist that's working with a child, the skill level of the therapist working with your child may be able to get improvements from the very first session all the way up to several months out, depending on how comfortable your child is with them and they are with your child. So as a parent, your job is to make sure to start therapy right away once your child is diagnosed with autism, to remain consistent, and to continue the therapy at home even when the therapist is not there. You want to embed those concepts into your everyday routines. Even when you know what your child wants, you still want to wait for them, give them a pause and a chance to use their learned communication skills and let you know what they want. Not just jump in there like a superhero and lose that learning opportunity for them to show off their skills. For parents in New York State, navigate autism with confidence. Call our office and empower your child's developmental journey with proven strategies and compassionate care. If you learned something today, please hit the like and subscribe buttons below and leave a comment to help spread the word. Imagine if you consistently witness your child making progress during their therapy journey and you stood back and had a 20,000 feet bird's eye view looking at the progress that they've made from who they were when they began to where they currently are. That progress may not be as fast as we always want to see, but focusing on the fact that they've made strides from one moment to the next is the key to helping them make the next jump and leap in their capabilities.